Medical Assistant Practice Test Part 2 2026, 100 questions with explained answer. Question 1. Coding systems are A. Used to place verbal descriptions of medical conditions or procedures into alphanumeric codes. B. A method of monitoring disease processes. C. Used to allow for easier statistical tracking of medical conditions or procedural uses. Or D. All of the above. The correct answer is D. All of the above. Medical coding systems like ICD-10 and CPT translate complex medical language into standardized alphanumeric codes. This process facilitates accurate billing, enables healthcare providers to monitor disease trends and health outcomes, and provides a structured way to track statistical data for research and public health purposes. Question 2. ICD-10 coding books A. Are organized into 3 volumes. B. Used to code diagnostic procedures. C. Are revised biannually. Or D. None of the above. The correct answer is A. Are organized into 3 volumes. The International Classification of Diseases, 10th revision, ICD-10, is traditionally organized into 3 volumes. Volume 1, Tabular List of Diseases. Volume 2, Instructional Manual/Rules. And Volume 3, Alphabetic Index. While the clinical modification, ICD-10-CM, is used for diagnoses, the books themselves follow this 3-volume structural framework. Question 3. Volume 2 of the ICD-10 coding book A. Is the 4-part alphabetical index. B. Contains procedural codes for specific diagnostic tests. C. Contains 3 sections with Section 3 being the index to diseases. Or D. None of the above. The correct answer is A. Is the 4-part alphabetical index. Volume 2 of the ICD-10 is the alphabetic index, which is critical for locating the correct code. It contains the index to diseases and injuries, the table of neoplasms, the table of drugs and chemicals, and the index to external causes of injury. It serves as the primary starting point for identifying the code that is then verified in the tabular list. Question 4. The CPT coding book A. Provides a 5-digit code for all procedures or services that may be performed on a patient. B. Provides numeric codes that allow for easier communication with insurance providers. C. Is divided into 6 sections. Or D. All of the above. The correct answer is C. Is divided into 6 sections. The current procedural terminology, CPT, code set, maintained by the AMA, is divided into 6 main sections: evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. While it uses 5-digit codes and aids insurance communication, the defining structural characteristic often emphasized in testing is its division into these 6 specific sections. Question 5. The write-at-once system is used in some offices as A. An alternative to a computerized scheduling systems. B. Hospital referral services. C. Computerized bookkeeping. Or D. Medical resource allocation. The correct answer is C. Computerized bookkeeping. The write-at-once system, also known as the pegboard system, is a manual bookkeeping method designed to reduce errors and save time by allowing a single entry to record information simultaneously on multiple forms, such as a day sheet, ledger card, and encounter form. It serves as a manual predecessor or alternative to computerized bookkeeping. Question 6. Restrictive endorsements on checks. A. Limit how a check can be cashed. B. Restrict the amount of money that can be received from a check. C. Prevents inaccurate records of deposit. Or D. None of the above. The correct answer is A. Limit how a check can be cashed. A restrictive endorsement limits the use of a check to a specific purpose, such as for deposit only. This prevents the check from being cashed by anyone other than the intended bank account holder, providing security if the check is lost or stolen. Question 7. When depositing checks in the bank, A. A deposit ticket must be filled out. B. Bills and checks must be listed individually. C. A signature is needed to withdraw cash. Or D. All of the above. The correct answer is D. All of the above. Standard banking procedures for deposits require a completed deposit ticket showing the account details and breakdown of funds. Checks and currency, bills, should be listed separately for auditing purposes. Additionally, if the depositor wishes to less cash back withdraw cash from the total deposit, a signature is required for verification. Question 8. A check stub. A is a smaller form to the left of each check that is used to manually record information placed on the check that is distributed. B is a booklet containing the banking information for the office. C is information that is used to deposit funds into the holder's account when signed by the payee. Or D, none of the above. The correct answer is A, is a smaller form to the left of each check that is used to manually record information placed on the check that is distributed. The check stub is the part of the check that remains in the checkbook after the check is detached. It provides a permanent record of the check number, date, payee, amount, and purpose, which is essential for accurate manual reconciliation of the bank account. Question 9. In order to ensure that a check can only be cashed once, A, the office manager should keep a running list of all of the checks used by that office. B, the bank will destroy all checks and any records of the check. C, checks that have been cashed should be locked in a designated area. Or D, checks are stamped by the bank when cashed. The correct answer is D, checks are stamped by the bank when cashed. When a bank processes a check, they stamp or digitally mark it as paid or cancelled. This cancellation ensures that the check cannot be presented for payment again, preventing double cashing and providing a clear audit trail. Question 10. Deductions are A, money owed to the practice. B, also known as debits. C, amounts that are to be added to the check register. Or D, none of the above. The correct answer is B, also known as debits. In accounting, a deduction or a debit refers to an amount that is subtracted from an account balance. For example, when money is spent or taken out of a business account, it is recorded as a debit or deduction from the available funds. Question 11. A patient is describing a contusion of his arm over the telephone to you. Which of the following descriptions would closely describe a contusion? A, blood collecting under the skin without a break in the skin. B, a clean cut that has broken the integrity of the skin. C, a jagged cut that has broken the integrity of the skin. Or D, a puncture which has pierced the top layers of the skin. The correct answer is A, blood collecting under the skin without a break in the skin. A contusion is the medical term for a bruise. It occurs when blunt force trauma causes blood vessels under the skin to rupture, leading to localized bleeding and discoloration, but without an external break or wound in the skin's surface. Question 12. The elderly and very young. A, have increased susceptibility to infectious pathogens. B, are more sensitive to heat and cold. C, have a higher risk of falls. Or D, all of the above. The correct answer is D, all of the above. Both infants and the elderly have unique physiological vulnerabilities. They often have less robust immune systems, making them more prone to infections. Their ability to regulate body temperature, thermoregulation, is also less efficient, and both groups are at a higher risk for accidents or falls due to developing or declining motor skills and balance. Question 13. Which would be the first step when a patient passes out at the front desk? A, call 911. B, initiate CPR. C, shake the patient and ask if he is okay. Or D, check for a pulse. The correct answer is C, shake the patient and ask if he is okay. The first step in any emergency assessment is to determine the patient's level of consciousness, responsiveness. This is typically done by using the tap and shout method, gently shaking the patient and loudly asking if they are okay, before proceeding to activate emergency services or check for vitals. Question 14. Which of the following is considered a best practice when preparing the office for emergency situations? A, document all training of employees on emergency situations. B, require all employees to have current CPR certification. C, have a current copy of all MSDS sheets for all chemicals used in the office. Or D, all of the above. The correct answer is D, all of the above. Comprehensive emergency preparedness includes ensuring all staff are trained and certified, CPR, maintaining safety documentation like material safety data sheets, MSDS/SDS, for hazardous materials, and keeping detailed records of all safety drills and training for compliance and liability purposes. Question 15. Triage in a medical office setting is primarily used to A. Verify insurance coverage before treatment. B. Sort and prioritize patients based on the severity of their condition. C. Determine the order of billing for daily services. Or D. Assign medical assistants to specific physicians. The correct answer is B. Sort and prioritize patients based on the severity of their condition. Triage is the process of evaluating patients to determine the urgency of their need for medical care. In an office setting, it ensures that patients with life-threatening or acute conditions receive immediate attention over those with routine or minor complaints. Question 16. When treating a patient with a suspected first-degree burn, the immediate first aid should include A. Applying ice directly to the site to reduce swelling. B. Applying butter or petroleum jelly to the skin. C. Running cool water over the area for several minutes. Or D. Removing any clothing that has stuck to the burn. The correct answer is C. Running cool water over the area for several minutes. First-degree burns affect only the outer layer of skin. The best immediate treatment is to cool the area using cool, not ice-cold, running water for at least 5 to 10 minutes. This helps dissipate heat and reduce pain. Applying ice can cause further tissue damage, and oils/fats like butter can trap heat and lead to infection. Question 17. Which acronym would best describe the procedure for assessing a patient that appears unconscious? A. WBC. B. QRS. C. XYZ. Or D. ABC. The correct answer is D. ABC. The ABC acronym stands for airway, breathing, and circulation. It is the primary sequence used by healthcare providers to assess and manage critical patients, ensuring the most life-threatening issues, blocked airway or lack of breathing/pulse, are addressed first. Question 18. Which of the following vital signs can be expected in a child that is afebrile? A. Rectal temp of 100.9 degrees Fahrenheit. B. Oral temp of 38 degrees Celsius. C. Axillary temp of 98.6 degrees Fahrenheit. Or D. All of the above are incorrect. The correct answer is C. Axillary temp of 98.6 degrees Fahrenheit. Afebrile means without a fever. A normal axillary temperature is approximately $98.6 degrees F, $37 degrees C. A rectal temp of $100.9 degrees F or an oral temp of $38 degrees C, $100.4 degrees F, would typically be considered febrile, having a fever, in a pediatric patient. Question 19. Intermittent fevers are A. Fevers which come and go. B. Fevers which rise and fall but are always considered above the patient's average temperature. C. Fevers which fluctuate more than 3 degrees never return to normal. Or D. None of the above. The correct answer is A. Fevers which come and go. An intermittent fever is characterized by body temperatures that return to normal, baseline, at least once every 24 hours but then rise above normal again. This is common in certain infections like malaria or septicemia. Question 20. A patient's body temperature has varied over the last 24 hours from 97.6 degrees Fahrenheit in the morning to 99 degrees Fahrenheit in the evening. The patient is worried that this change in temperature may indicate the beginning of a fever. Which of the following best explains this phenomenon? A. The patient definitely has a fever in the evening and should be seen by a doctor. B. The patient is experiencing changes related to a diurnal rhythm. C. The patient is more than likely taking her temperature incorrectly. Or D. The patient is male and is experiencing changes related to fluctuating monthly hormones. The correct answer is B. The patient is experiencing changes related to a diurnal rhythm. Body temperature naturally fluctuates throughout the day, usually being lowest in the early morning and highest in the late afternoon or evening. This pattern is known as a diurnal rhythm, or circadian rhythm, and a variation of $1 to $1.5 degrees Fahrenheit is considered normal. Question 21. The most accurate reading for a temperature is done A. Orally. B. Orally through a clean canal. C. Rectally. Or D. Axially. The correct answer is C. Rectally. Rectal temperature is considered the most accurate, gold standard measurement of core body temperature because it is less affected by external factors like mouth breathing, recent ingestion of hot/cold liquids, or ambient air temperature. Question 22. A patient is having difficulty understanding how to properly run her glucose meter. Which of the following teaching methods would best help the patient understand how to use her instrument correctly? A. Give the patient an instruction booklet and have her call the office if she has questions. B. Tell the patient to have a family member demonstrate how to use the instrument. C. Have the patient watch a video on the use of the instrument. Or D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. The correct answer is D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. The teach-back or demonstration return demonstration method is the most effective way to ensure patient understanding of a technical skill. By observing the patient perform the task, the educator can correct errors in real time and confirm the patient is competent to do it at home. Question 23. The pulse point located on the top of the foot is A. The dorsalis pedis. B. Is checked in patients with peripheral vascular problems. C. Absent in some patients due to a congenital anomaly. Or D. All of the above. The correct answer is D. All of the above. The dorsalis pedis pulse is located on the dorsum, top, of the foot. It is frequently assessed to check the adequacy of circulation to the lower extremities, especially in diabetic or vascular patients. Interestingly, about $10% of the population may lack a palpable dorsalis pedis pulse due to anatomical variation. Question 24. Over a patient's lifespan, the pulse rate A. Starts out fast and decreases as the patient ages. B. Starts out slower and increases as the patient ages. C. Varies from slow to fast throughout the lifespan. Or D. Stays consistent from birth to death. The correct answer is A. Starts out fast and decreases as the patient ages. Heart rate and pulse rate are highest at birth, averaging $120 to $160 beats per minute in newborns, and gradually decrease through childhood until reaching the adult resting range of $60 to $100 beats per minute. Question 25. A common error when taking a pulse is A. Placing the index finger on the radial artery which is located on the thumb side of a patient's wrist. B. Noting a pulse as being weak when the pulsation disappears upon adding pressure. C. Counting the pulse for 15 seconds and multiplying the number by 4. Or D. None of the above will cause errors. The correct answer is C. Counting the pulse for 15 seconds and multiplying the number by 4. While multiplying $15 seconds by $4 is common, it increases the margin of error, especially if the rhythm is irregular. For maximum accuracy, particularly if an abnormality is suspected, the pulse should be counted for a full $60 seconds. Option A is the correct technique. Option B describes thready pulse assessment. Question 26. A patient is in the office for a cyst removal and is very anxious about the procedure. Which of the following descriptions of his respirations would be expected? A. Bradypnea. B. Orthopnea. C. Tachypnea. Or D. Dyspnea. The correct answer is C. Tachypnea. Tachypnea is an abnormally rapid breathing rate. Anxiety and stress trigger the sympathetic nervous system, fight or flight, which naturally increases the respiratory rate to provide more oxygen to the body in anticipation of a perceived threat. Question 27. Rales and rhonchi are frequently noted during an examination of lung sounds. What is the difference between the two? A. Rales are louder. B. Rhonchi are noted only in infants. C. Rales occur on inspiration, rhonchi on expiration. Or D. Rales are noted only in infants. The correct answer is C. Rales occur on inspiration, rhonchi on expiration. Rales, crackles, are clicking or rattling sounds heard usually during inspiration, caused by the opening of small airways or fluid in the alveoli. Rhonchi are deeper, snoring-like sounds often heard during expiration, caused by secretions or obstruction in the larger airways. Question 28. To accurately assess a patient's respiration rate, which of the following methods would be best? A. Tell the patient please remain silent while I count your number of breaths. B. Count respirations at the same time you are counting the pulse rate. C. Count the pulse rate for 1 minute, then while keeping your index fingers on the patient's radial artery count the respirations for an additional minute. Or D. Count the patient's respiration rate, then take the patient's temperature and then take the pulse rate. The correct answer is C. Count the pulse rate for 1 minute, then while keeping your index fingers on the patient's radial artery count the respirations for an additional minute. Respiration is partially under voluntary control. If a patient knows their breathing is being counted, they may inadvertently change their pattern. The best technique is to continue holding the wrist as if still taking the pulse, so the patient remains unaware you are actually counting their breaths. Question 29. A patient is diagnosed with essential hypertension. Which of the following blood pressures would you expect to see in this patient prior to taking medications for his condition? A. 142/92. B. 118/72. C. 120/80. Or D. 138/88. The correct answer is A. 142/92. Stage 2 hypertension is generally defined as a systolic pressure of $140 mmHg or higher, or a diastolic pressure of $90 mmHg or higher. $142/92 falls clearly into the hypertensive range, whereas the other options are normal or elevated/prehypertensive. Question 30. The common law source of laws is A. Derived from customs and judicial decisions. B. Derived from the U.S. Constitution. C. Derived from state/federal legislation. Or D. None of the above. The correct answer is A. Derived from customs and judicial decisions. Common law, also known as case law, is the body of law created by judges and similar quasi-judicial tribunals by virtue of being stated in written opinions. It is based on historical customs and legal precedents rather than statutory laws passed by legislatures. Question 31. A woman is being accused of failure to pay her medical bills. Which of the following classifications of law is she violating? A. Criminal law. B. Civil law. C. Felony. Or D. Family law. The correct answer is B. Civil law. Failure to pay a debt, like a medical bill, is a breach of contract, which falls under civil law. Civil law deals with disputes between individuals or organizations, where the goal is usually compensation or specific performance rather than imprisonment. Question 32. A medical assistant graduate wishes to receive credentials in the state of Ohio. She voluntarily chooses to take an examination from the American Association of Medical Assistants. When she passes the exam, she will receive the CCMA credential. Which of the following is true? A. The graduate has elected to become certified. B. The graduate has chosen to become licensed by the state of Ohio. C. The graduate will be registered as a medical assistant when she passes the EMA examination. Or D. None of the above. The correct answer is A. The graduate has elected to become certified. Medical assisting is typically a certified profession rather than a licensed one. Certification is a voluntary process through a private organization, like the AAMA, to demonstrate competency. Licensure is a mandatory state-regulated process required to practice a profession. Question 33. When practicing reciprocity, which of the following is true of the CCMA credentials? A. The CCMA credential indicates licensure in all 50 states. B. The CCMA credential is interchangeable with other medical assisting credentials in all 50 states. C. The CCMA credential is a national credential and may be recognized in all 50 states. Or D. None of the above. The correct answer is D. None of the above. Reciprocity usually refers to the mutual recognition of licenses between states. Since CCMA, AAMA, is a national certification and not a state license, the concept of reciprocity doesn't strictly apply in the same way as it does for doctors or nurses. While the credential is recognized nationally, the answer choice D reflects the legal nuance of reciprocity versus certification. Question 34. A physician is explaining a procedure to a patient that may cure her recurring staph infection. The doctor explains how the procedure is done, what to expect, the odds of the procedure curing the infection, and possible side effects and risks. The physician is A. Preparing the patient to give informed consent. B. Protecting HIPAA by listing all of the steps of the procedure with the risks involved. C. Not required to inform the patient of any alternative therapies. Or D. None of the above. The correct answer is A. Preparing the patient to give informed consent. Informed consent requires that the patient understands the nature of the treatment, the expected benefits, the risks involved, and any alternative treatments. By providing this detailed explanation, the physician is ensuring the patient can make an educated decision about their care. Question 35. An emancipated minor has come to the office for information on cervical cancer and has also requested testing. The office is not required to inform the patient parents because A. Cervical cancer is closely related to STDs, so the office is covered by law to not be required to notify the minor's parent. B. Emancipated minors have legal independence from parents or legal guardians. C. Testing for cervical cancer can be done on minors without legal parental or guardian consent. Or D. None of the above. The correct answer is B. Emancipated minors have legal independence from parents or legal guardians. An emancipated minor is a person under the age of majority who has been legally granted the rights and duties of an adult by a court. This includes the right to consent to medical treatment and the right to medical privacy from their parents. Question 36. After a lengthy explanation of a medical procedure, the patient asks many questions. The physician answers all of the questions to the best of her ability. The patient then gives consent for treatment. The costly equipment and supplies are put into place and the patient is prepared. 2 minutes before the procedure is to start, the patient begins panicking and changes her mind. Which of the following situations would be the best way to avoid litigation? A. Document that the patient originally gave consent and proceed if the benefits of the procedure outweigh the patient's wishes. B. Have the patient sign a form that she is refusing consent. If she refuses to sign, proceed with the procedure. C. Repeat the explanation of the procedure until the patient understands that having the procedure done is the best form of treatment. Proceed with the procedure. Or D. Do not proceed. Document the patient refusal. Have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. The correct answer is D. Do not proceed. Document the patient refusal. Have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. A patient has the right to withdraw consent at any time before or even during a procedure. If they withdraw consent, the procedure must stop immediately, unless stopping would cause immediate harm. To protect the office legally, the refusal must be meticulously documented and witnessed. Question 37. Advanced directives are A. Required by law. B. Chosen by family members. C. Used to support a patient's wishes. Or D. Costly and difficult to prove by law. The correct answer is C. Used to support a patient's wishes. Advanced directives, like a living will or healthcare proxy, are legal documents that allow individuals to state their preferences for medical care in the event they become unable to communicate or make decisions for themselves. They ensure the patient's autonomy is respected. Question 38. A patient sues a physician for malpractice. The judge awards in favor of the physician. The patient cannot resue the physician due to A. Residential ipsa loquitur. B. Residential judicata. C. Respondeat superior. Or D. Subpoena duces tecum. The correct answer is B. Residential judicata. Residential judicata is a legal doctrine that means a matter judged. It prevents the same parties from litigating the same issue again once a final judgment has been reached by a competent court. Question 39. Of the 4 Ds of negligence which exists when the physician pays for injuries that the client sustained due to improper care? A. Duty. B. Dereliction. C. Direct cause. Or D. Damages. The correct answer is D. Damages. The 4 Ds of negligence are duty, obligation to care, dereliction, breach of duty, direct cause, injury caused by breach, and damages, financial compensation awarded for the injury. Damages refer to the actual loss or harm for which the patient seeks compensation. Question 40. Which of the following choices would best answer the question who owns a patient's medical record? A. The patient. B. The physician. C. The legal counsel of the office. Or D. no one owns a medical record. The correct answer is B, the physician. Legally, the physical or electronic medical record is the property of the physician or the healthcare facility that created it. However, the patient owns the information contained within the record and has a right to access or obtain copies of it under HIPAA. Question 41. Which of the following choices would best answer the question who owns a patient X-rays? A. The patient. B. The doctor. C. The facility that performed the procedure. Or D. None of the above. The correct answer is C. The facility that performed the procedure. Similar to medical records, the physical X-ray films, or digital files, belong to the facility where the procedure was performed. The patient pays for the interpretation of the X-ray and has a right to the results and copies of the images, but the original belongs to the facility. Question 42. Which of the following reasons would be legal when considering a patient's medical record? A. Allowing a patient's brother to view her chart to find out her birth date and address so that he can mail her a card. B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. C. Not allowing a patient to view her chart because she is behind on her payments. Or D. All of the above are legal. The correct answer is B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. While patients generally have a right to their records, HIPAA allows a narrow exception where a physician may withhold information if they believe access is reasonably likely to endanger the life or physical safety of the patient or another person. Question 43. Choose the best answer to ensure adequate protection for legal issues. Offices should maintain patient charts for A. 10 years. B. Forever. C. Until the age of majority. Or D. 2 years after the patient was last seen in the office. The correct answer is B. Forever. While state laws vary on mandatory retention periods, often $7-$10 years, many legal experts recommend keeping records forever or as long as possible, because of the varying statutes of limitations for different types of lawsuits, especially in pediatrics. Question 44. The term afferent nerve means A. Carrying an impulse to the brain. B. Carrying an impulse away from the brain. C. Carrying impulses to the motor neurons of the appendicular muscles. Or D. None of the above. The correct answer is A. Carrying an impulse to the brain. Afferent nerves, sensory nerves, carry impulses from sensory receptors in the body toward the central nervous system, the brain and spinal cord. Conversely, efferent nerves carry motor impulses away from the brain to the muscles. Question 45. The medical term basophilia refers to A. An attachment of the epithelial cells of the skin to a basement membrane. B. An overabundance of a particular white blood cell in the peripheral blood. C. An underrepresentation of basophils on a blood smear. Or D. None of the above. The correct answer is B. An overabundance of a particular white blood cell in the peripheral blood. Basophilia is a condition where there is an abnormally high concentration of basophils, a type of white blood cell, in the blood. This can be seen in inflammatory conditions, allergic reactions, or certain types of leukemia. Question 46. When considering the structural organization of the human body, which of the following is the basic unit of life? A. Chemicals. B. Atoms. C. Molecules. Or D. Cells. The correct answer is D. Cells. The cell is defined as the smallest structural and functional unit of an organism, which is typically microscopic and consists of cytoplasm and a nucleus enclosed in a membrane. It is the fundamental building block of all living things. Question 47. When a patient is standing in anatomical position, where are his feet? A. Facing forward with the toes spread open. B. Facing out to the sides to open the hips. C. Side by side and facing forward, toes resting comfortably. Or D. The feet are pointed inward. The correct answer is C. Side by side and facing forward, toes resting comfortably. In the standard anatomical position, the body is upright, facing forward, arms at the sides with palms facing forward, and the feet are flat on the floor, side by side, and pointing forward. Question 48. A physician asks you to place the patient with his dorsal side facing the exam table. Which of the following accurately describes how the patient is positioned? A. The patient is lying prone. B. The patient is lying supine. C. The patient is lying in the recover position. Or D. The patient is lying on his stomach. The correct answer is B. The patient is lying supine. The dorsal side refers to the back. If the patient's back is against the exam table, they are lying face up. The medical term for lying on the back, face up, is the supine position. Prone would mean lying face down. Question 49. The body plane that divides the body into right and left sides is the A. Frontal plane, B. Medical plane, C. Median plane, or D. Transverse plane. The correct answer is C. Median plane. The median, or sagittal, plane runs vertically from front to back and divides the body into right and left portions. A mid-sagittal plane specifically divides the body into equal right and left halves. Question 50. A patient is asked to abduct her arms. Which of the following accurately describes her arm movement? A. She moves her arms away from her trunk. B. She moves her arms toward her trunk. C. She rotates her arms at the wrists while holding them toward her feet. Or D. She crosses her arms over her abdomen. The correct answer is A. She moves her arms away from her trunk. Abduction is a movement that draws a limb away from the midline or trunk of the body. Adduction is the opposite, drawing the limb toward the midline. Question 51. Which of the following sets of word parts means pain? A. Dynia and algia. B. A and N, C, IA and A. Or D. Pathy and ossis. The correct answer is A. Dynia and algia. In medical terminology, both the suffix dynia example gastrodynia and algia example neuralgia mean pain. Question 52. A common childhood illness is caused by the Bordetella pertussis bacterium. Which of the following diseases is caused by this bacteria? A. German measles, B. RSV, C. Meningitis, or D. Whooping cough. The correct answer is D. Whooping cough. Pertussis, commonly known as whooping cough, is a highly contagious respiratory tract infection caused by the bacterium Bordetella pertussis. It is characterized by severe hacking coughs followed by a high-pitched intake of breath that sounds like a whoop. Question 53. Which of the following glands found in the skin secretes a liquid called sebum? A. Apocrine glands, B. Sebaceous glands, C. Lacrimal glands, or D. Sweat glands. The correct answer is B. Sebaceous glands. Sebaceous glands are microscopic exocrine glands in the skin that open into a hair follicle to secrete an oily or waxy matter, called sebum, which lubricates and waterproofs the skin and hair. Question 54. A patient that has been diagnosed with alopecia would be described as having A. Body lice, B. Lack of ear lobes, C. Indigestion, or D. Hair loss. The correct answer is D. Hair loss. Alopecia is the general medical term for hair loss. It can occur on the scalp or elsewhere on the body and can be temporary or permanent. Question 55. Which of the following anticoagulants would be found in a light blue vacutainer tube? A. EDTA, B. Sodium oxalate, C. Lithium heparin, or D. Sodium citrate. The correct answer is D. Sodium citrate. Light blue top tubes contain sodium citrate as an anticoagulant. These tubes are used for coagulation studies, like point/INR and PTT, because the citrate preserves the clotting factors by binding calcium. Question 56. A medical assistant is asked to draw blood in the antecubital space. Which of the following veins are found in the AC? A. Cephalic, B. Median cubital, C. Basilic, or D. All of the above. The correct answer is D. All of the above. The antecubital, AC, fossa is the most common site for venipuncture. It contains three main veins used for drawing blood: the median cubital, preferred, the cephalic, thumb side, and the basilic, pinky side. Question 57. A patient's urine specimen tested positive for bilirubin. Which of the following is most true? A. The patient should be evaluated for kidney disease. B. The specimen was probably left at room temperature for more than 2 hours. C. The specimen is positive for bacteria. Or D. The specimen should be stored in an area protected from light. The correct answer is D. The specimen should be stored in an area protected from light. Bilirubin is light sensitive. If a urine specimen containing bilirubin is exposed to light, especially sunlight or fluorescent light, for an extended period, the bilirubin will break down and may result in a false negative test result. Therefore, specimens suspected of having bilirubin should be protected from light. Question 58. Which vacutainer tubes should be used when a requisition calls for blood to be drawn for an HNH and glucose test? A. 1 light blue 1 red. B. 2 lavenders. C. 1 lavender 1 gray. Or D. 1 green 1 red. The correct answer is C. 1 lavender 1 gray. HNH, hemoglobin and hematocrit, requires a CBC, which is drawn in a lavender top tube, containing EDTA. Glucose testing often requires a gray top tube, containing sodium fluoride and potassium oxalate, to prevent glycolysis, the breakdown of sugar. Question 59. Specific gravity in urinalysis. A. Compares the concentration of urine to that of distilled water. B. Is useless when the patient is dehydrated. C. Can only be done with a refractometer. Or D. None of the above. The correct answer is A. Compares the concentration of urine to that of distilled water. Specific gravity measures the concentration of particles in the urine. It is a ratio that compares the weight of the urine to the weight of an equal volume of distilled water, which has a specific gravity of $1.000. Question 60. When placing a patient in the AP position for an X-ray, what position would the patient be in? A. Facing the film. B. Right side against the film. C. Left side against the film. Or D. Facing away from the film. The correct answer is D. Facing away from the film. AP stands for anteroposterior. In an AP projection, the X-ray beam enters the anterior, front, of the body and exits the posterior, back. Therefore, the patient's back is against the film, or detector, and they are facing away from the film, toward the X-ray tube. Question 61. A patient's urine tests positive for glucose. The doctor asks you to confirm this finding. Which of the following would best confirm this finding? A. Run the urine on the handheld glucometer. B. Have another mod do a repeat dipstick. C. Run a clinitist. Or D. Run an acid test. The correct answer is C. Run a clinitist. A clinitist, copper reduction test, is often used to confirm the presence of glucose or other reducing sugars in the urine when a dipstick is positive. An acid test is used to confirm the presence of ketones. Question 62. The smallest of the white blood cells which also can be involved in humoral immunity is the A. Lymphocyte. B. Monocyte. C. Basophil. Or D. Erythrocyte. The correct answer is A. Lymphocyte. Lymphocytes are the smallest white blood cells. B lymphocytes are responsible for humoral immunity, producing antibodies, while T lymphocytes are responsible for cell-mediated immunity. Question 63. Your doctor has given you a patient memo that he has written. You notice that his grammar and punctuation need to be corrected. Which of the following proofreader's mark signifies that a period is to be introduced into a sentence? A. Equal sign. B. Circle with a dot in the middle. C. Ellipsis. Or D. Empty circle. The correct answer is B. Circle with a dot in the middle. In standard proofreading, a period is indicated by a circle with a dot in the center. An equal sign often indicates a hyphen, and an ellipsis indicates omitted text. Question 64. As a rule of social acceptance, what is the maximum number of times a telephone should be allowed to ring in most cases? A. 3. B. 5. C. 7. Or D. 1. The correct answer is A. 3. In a professional medical setting, the standard etiquette is to answer the phone by the third ring. This shows efficiency and respect for the caller's time. Question 65. When answering the telephone other than taking a patient's name, what other piece of information should be gathered at the beginning of the call? A. Telephone number. B. Date of birth. C. Reason for the call. or D. Address? The correct answer is A. Telephone number. It is critical to obtain the caller's phone number early in the conversation in case the call is accidentally disconnected. This allows the staff to call the patient back immediately. Question 66. Which of the following telephone greetings would be best? A. Hello, Dr. Smith's office, please hold. B. Dr. Smith's office, how may I assist you? C. Dr. Smith's office, this is Mary, how may I assist you? Or D. Dr. Smith's office, this is Mary. The correct answer is C. Dr. Smith's office, this is Mary, how may I assist you? A professional greeting should include the name of the facility, the name of the person answering, and an offer of assistance. This builds rapport and provides the caller with necessary information immediately. Question 67. Which of the following responses would be best when addressing an irate and shouting patient at the front desk? A. Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. B. Mr. Jones, stop yelling. If you cannot stop yelling, I will have to ask you to leave. C. This isn't my fault. Or D. Mr. Jones, I'm sure we can fix this issue very quickly. The correct answer is A. Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. The goal when dealing with an angry patient is to de-escalate the situation, acknowledging their feelings, empathy, and offering a solution without being defensive or confrontational is the most professional approach. Question 68. Insured mail through the USPS is defined as A. Mail that is guaranteed to reach its intended destination. B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. C. Mail that will require a signature upon delivery. Or D. None of the above. The correct answer is B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. Insured mail provides coverage against loss or damage for a fee, based on the declared value of the item. If the item is lost or damaged by the USPS, the sender can be reimbursed up to the insured amount. Question 69. A physician has requested that a letter notifying his patient that he can no longer care for her due to her multiple no-shows would be best sent. A. Insured. B. Parcel post. C. Certified. Or D. COD. The correct answer is C. Certified. Certified mail provides the sender with a mailing receipt and electronic verification that an article was delivered or that a delivery attempt was made. In medical law, this is used to provide legal proof that a termination notice was sent and received, preventing claims of abandonment. Question 70. The postal abbreviation for Idaho is A. IH, B. IO, C. IA, or D. ID. The correct answer is D. ID. The official two-letter USPS abbreviation for the state of Idaho is ID. Question 71. The standard for folding an 8 1/2 by 11 in letter to fit in a number 10 envelope is A. Fold in half long ways. B. Fold in half short ways. C. Fold into thirds by pulling the bottom up and then top down. Or D. Folding into thirds by pulling the top down and then bottom up. The correct answer is C. Fold into thirds by pulling the bottom up and then top down. To properly fold a standard business letter for a /#10 envelope, you should fold the bottom third of the paper up, and then fold the top third down over it. This ensures the letter is neat and easy for the recipient to open. Question 72. Patients with irritable bowel syndrome will experience which of the following symptoms? A. Diarrhea. B. Flatulence. C. Constipation. Or D. Patients can experience a variety of symptoms that can include all of the above. The correct answer is D. Patients can experience a variety of symptoms that can include all of the above. Irritable bowel syndrome, IBS, is a functional disorder of the digestive tract. It is characterized by a group of symptoms that occur together, including abdominal pain and changes in bowel movements, which may be diarrhea, constipation, or both, along with bloating and gas. Question 73. Diabetic patients are monitored by using which of the following tests? A. TUB. B. Troponin. C. F++. Or D. HbA1c. The correct answer is D. HbA1c. The HbA1c, hemoglobin A1c, test measures the average blood sugar levels over the past 2 to 3 months. It is the standard test for monitoring long-term glucose control in patients with diabetes. Question 74. Patients diagnosed with hypertension are given a medication called hydrochlorothiazide. How does this medication work to treat hypertension? A. It reduces the amount of red blood cells in the bone marrow. B. It allows muscles to contract more forcefully. C. It increases urination. Or D. None of the above. The correct answer is C. It increases urination. Hydrochlorothiazide is a thiazide diuretic water pill. It works by causing the kidneys to remove excess water and salt from the body through urine. This reduces the total volume of blood the heart has to pump, thereby lowering blood pressure. Question 75. Psoriasis. A. May be treated with phenytoin. B. Is a skin condition involving flaky or oozing patches of skin. C. Is most commonly found on the backs of the legs. Or D. None of the above. The correct answer is B. Is a skin condition involving flaky or oozing patches of skin. Psoriasis is a chronic autoimmune skin disease that speeds up the life cycle of skin cells. It causes cells to build up rapidly on the surface of the skin, forming thick, silvery scales and itchy, dry, red patches that can sometimes ooze or crust. Question 76. Patients who have anxiety. A. Are treated episodically. B. Are treated prophylactically. C. May be treated with citalopram. Or D. All of the above. The correct answer is D. All of the above. Anxiety can be treated as it occurs, episodically, example, with benzodiazepines for panic attacks, or preventatively, prophylactically, example, with daily SSRIs like citalopram. Many patients use a combination of these approaches. Question 77. Skin nodules such as nevi. A. May become malignant. B. Should be seen by a physician even if not suspicious. C. Are graded using an acronym ABCDE. Or D. All of the above. The correct answer is D. All of the above. A nevus, mole, should be monitored for changes that could indicate skin cancer, malignancy. The ABCDE rule, asymmetry, border, color, diameter, evolving, is used for assessment. Even non-suspicious moles should be part of a regular skin check by a physician. Question 78. Category A drugs include those that choose the best answer. A. Can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. B. Have been proven to be dangerous when taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. C. Have a high potential for abuse. Or D. Have a low potential for abuse. The correct answer is A. Can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. FDA pregnancy category A drugs are those where adequate and well-controlled studies have failed to demonstrate a risk to the fetus in the first trimester, and there is no evidence of risk in later trimesters. They are considered the safest medications for use during pregnancy. Question 79. Drug schedules. A. Relate to controlled substances. B. Are based on the potential for abuse. C. Are scheduled in 5 categories with Schedule 1 being the most dangerous. Or D. All of the above. The correct answer is D. All of the above. Controlled substances are categorized into 5 schedules, I through V, based on their medical use, potential for abuse, and safety or dependency liability. Schedule I drugs have the highest potential for abuse and no accepted medical use. Question 80. If a doctor's order calls for the administration of 500 mg of medication, how many grams should be given? A. 500. B. 50. C. 0.5. Or D. 5. The correct answer is C. 0.5. There are $1,000 milligrams, mg, in $1 gram, g. To convert mg to g, divide by $1,000, $500 text, mg, /1000 equals 0.5 text, g, dollar. Question 81. Which of the following medications would be given to treat vomiting? A. Cysteine, B. Acetaminophen, C. Lisinopril, or D. Promethazine? The correct answer is D. Promethazine. Promethazine, Phenergan, is an antihistamine and antiemetic used to prevent and treat nausea and vomiting related to certain conditions, like before/after surgery or motion sickness. Question 82. A patient has been diagnosed with an irregular heartbeat. Which of the following medications would be prescribed to treat this condition? A. Antiarrhythmic, B. Antipsychotic, C. Cathartic, or D. Antiseptic? The correct answer is A. Antiarrhythmic. Antiarrhythmic medications are used to suppress abnormal rhythms of the heart, cardiac arrhythmias, such as atrial fibrillation, atrial flutter, or ventricular tachycardia. Question 83. Which of the following drugs would be used to treat GERD? A. Claritin, B. Nexium, C. Nuprin, or D. Celexa? The correct answer is B. Nexium. Nexium, esomeprazole, is a proton pump inhibitor, PPI, that decreases the amount of acid produced in the stomach. It is used to treat symptoms of gastroesophageal reflux disease, GERD, and other conditions involving excessive stomach acid. Question 84. Of the following medications which is not used to treat depression? A. Sertraline hydrochloride, B. Paroxetine hydrochloride, C. Citalopram, or D. Nifedipine? The correct answer is D. Nifedipine. Sertraline, Zoloft, paroxetine, Paxil, and citalopram, Celexa, are all SSRIs used for depression. Nifedipine, Procardia, is a calcium channel blocker used to treat high blood pressure and chest pain, angina. Question 85. Which of the following formulas would correctly solve a dosage calculation problem? A. Order dosage/dosage on hand * amount of drug equals dosage to be given. B. Dosage on hand / ordered dosage * amount of drug equals dosage to be given. C. Amount of drug / ordered dosage * dosage on hand equals dosage to be given. Or D. None of the above are correct. The correct answer is A. Order dosage / dosage on hand * amount of drug equals dosage to be given. The standard formula for drug dosage calculation is desired dose/dose on hand, $/ quantity equals amount to give. This ensures the patient receives the exact amount prescribed based on the concentration of the medication available. Question 86. Which of the following agencies would be responsible for monitoring the use of controlled substances? A. CDC, B. DEA, C. MA, or D. FDA? The correct answer is B. DEA. The Drug Enforcement Administration, DEA, is the federal agency responsible for enforcing the Controlled Substances Act and regulating the distribution and use of drugs with potential for abuse. Question 87. A medical assistant is going to give a subcutaneous injection. Which of the following is true concerning this procedure? A. No more than 2 milliliters of medication should be injected using the sub method. B. The angle of the needle should be 90 degrees. C. The injection can be given in the antecubital space. Or D. The needle length should be greater than 1 inch. The correct answer is A. No more than 2 milliliters of medication should be injected using the sub method. A subcutaneous, sub-Q, injection is given into the fatty tissue just below the skin. Usually, no more than $1.5 to $2 ml of medication is injected at one site to avoid tissue damage. The angle is typically $45 degrees, though can be $90 degrees for shorter needles/insulin, and the antecubital space is used for venipuncture, not sub-Q injections. Question 88. Elizabeth Kubler-Ross is known for developing the stages of grief. Which of the following is true of these stages? A. All patients will go through all 5 stages of grief. B. Each patient will go through the stages of grief in the same order but not necessarily in the same amount of time. C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. Or D. The stages of grief are an antiquated method of psychology and are not recognized in current practice. The correct answer is C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. The 5 stages of grief, denial, anger, bargaining, depression, acceptance, are not linear. Not everyone experiences every stage, and they can occur in any order or cycle back and forth as an individual processes loss. Question 89. The hierarchy of needs was proposed by which of the following psychology researchers? A. Maslow, B. Freud, C. Erikson, or D. Skinner? The correct answer is A. Maslow. Abraham Maslow proposed the hierarchy of needs, a motivational theory in psychology comprising a 5-tier model of human needs, often depicted as hierarchical levels within a pyramid, starting from physiological needs up to self-actualization. Question 90. Which of the following scenarios accurately describes self-actualization? A. Finding belongingness to a group. B. Recognizing one's worth to society. C. Feeling safe in one's environment. Or D. Reaching one's full potential. The correct answer is D. Reaching one's full potential. Self-actualization is the highest level of Maslow's hierarchy. It represents the realization or fulfillment of one's talents and potentialities, especially considered as a drive or need present in everyone. Question 91. According to life's 8 development stages, trust and mistrust are most likely experienced. A. Shortly after birth. B. The preteen years. C. Middle age. Or D. Old age. The correct answer is A. Shortly after birth. In Erik Erikson's stages of psychosocial development, trust versus mistrust is the first stage, occurring from birth to approximately 18 months. Infants learn to trust their caregivers based on the consistency and reliability of having their basic needs met. Question 92. Classical conditioning is demonstrated in which of the following examples? A. A child starts crying upon mention of going to the doctor. B. A dog barks when seeing a stranger. C. A patient is startled when a medical assistant quickly opens a door without announcing his presence. Or D. A big baby boy urinates every time his diaper is removed to be changed. The correct answer is A. A child starts crying upon mention of going to the doctor. Classical conditioning involves learning through association. A child who has had painful experiences at the doctor, like shots, learns to associate the word doctor with pain, leading to an emotional response, crying, before even arriving at the clinic. Question 93. B.F. Skinner is regarded as being the primary researcher for which learning method? A. Classical conditioning. B. Operant conditioning. C. Trial and error. Or D. Kinesthetic learning principle. The correct answer is B. Operant conditioning. B.F. Skinner is the father of operant conditioning, a method of learning that occurs through rewards and punishments for behavior. This theory suggests that behavior is shaped by its consequences. Question 94. Nonverbal communication is A. Not the most utilized form of communication. B. Uses facial expression and body language to send messages. C. Most often used when sending messages over email or telephone. Or D. An ineffective manner of communication. The correct answer is B. Uses facial expression and body language to send messages. Nonverbal communication includes gestures, facial expressions, eye contact, posture, and tone of voice. It is estimated that a significant majority of human communication is nonverbal, often conveying more meaning than spoken words. Question 95. Which of the following scenarios provides an example of a medical assistant overcoming a barrier to communication? A. A medical assistant uses a lecture as a means of explaining how to run a finger-stick glucose test to an elderly patient. B. A medical assistant writes her directions to a patient that is hearing impaired. C. A medical assistant speaks loudly to a patient who speaks a non-English language. Or D. A medical assistant uses the terms at and defecation while talking with a minor. The correct answer is B. A medical assistant writes her directions to a patient that is hearing impaired. Writing directions for a hearing impaired patient is a practical way to overcome a physical barrier to communication, ensuring the patient receives and understands the necessary information. Question 96. of the following choices which should not be considered when performing payroll functions? A. Number of exemptions. B. Deductions. C. Hours worked. Or D. Number of patients roomed per day. The correct answer is D. Number of patients roomed per day. Payroll functions involve calculating gross pay, hours worked $times $rate, subtracting mandatory and voluntary deductions, taxes, insurance, etc., and considering tax exemptions. Productivity metrics like patients roomed per day are performance indicators but not direct factors in standard payroll calculations. Question 97. Which of the following tasks is not the responsibility of the office manager? A. Maintain adequate supply of inventory. B. Perform employee evaluations. C. Ensure adequate staffing. Or D. Determine the appropriate number of tax exemptions that should be made by an employee. The correct answer is D. Determine the appropriate number of tax exemptions that should be made by an employee. The number of tax exemptions, allowances, is determined by the employee themselves when they complete their W-4 form. The office manager or employer simply processes the payroll based on the information provided by the employee. Question 98. What is the best time of the day to hold an all-staff meeting? A. Right after lunch. B. Just prior to the office closing. C. At the beginning of the day. Or D. Various times of the day. The correct answer is C. At the beginning of the day. Holding meetings at the beginning of the day, often as a morning huddle, is considered best practice. It ensures everyone is on the same page before the day's tasks begin and doesn't interrupt the workflow later when patients are present. Question 99. Which of the following employment forms is necessary when considering choosing taxes exemptions? A. W-2. B. W-4. C. I-9. Or D. C-3 power. The correct answer is B. W-4. The W-4 form, Employee's Withholding Certificate, is completed by an employee so the employer can withhold the correct amount of federal income tax from their pay, based on their personal situation and desired exemptions. Question 100. When setting up the front desk, which of the following would enhance patient privacy? A. Having a sliding window that can be closed when not conversing with patients. B. Having a privacy filter on computer monitors. C. Asking patients to stand at least 5 feet from the front desk until it's their turn. Or D. All of the above. The correct answer is D. All of the above. Patient privacy, HIPAA compliance, at the front desk is maintained through physical barriers, sliding windows, visual privacy, monitor filters, and acoustic/spatial distance, stand-back lines, to prevent other patients from hearing or seeing sensitive information.